Hey, this is Dr. Brophy, Mary Brophy. I'd like to get the meeting for the Board of Health for Tuesday, January 7th opened. Well, welcome to everyone. On the meeting today is the Executive Officer, Dr. Monsoor, Dr. Andre, and Mr. Fisk, who are present, so full board attendance at the meeting. So first item on the agenda is minutes that were available from the December board meeting. Can I have a motion to approve the minutes and any edits or changes that need to be made to the minutes?
Motion to approve.
Any
Motion to
second?
accept.
Okay, all in favor?
Second.
Aye.
Aye, okay.
Aye.
Second item on the agenda, we have, Dr. Monsoor, maybe you can fill us in. We've done our due diligence and we have a freezer purchased to allow us to store the vaccine. So why don't you fill us in on it, where it's located, and sort of give us some updates on the plans for the city.
Okay, thank you. Thank you, and Happy New Year, everyone. The Board of Health has worked diligently with the city departments, many different departments, because we had the plan to purchase a freezer to be able to store vaccines for COVID. Now, when we started early December, we were not sure whether or not we would get the Pfizer vaccine or the Moderna, but it seemed that the Pfizer was going a little bit ahead of time. So we planned to buy a freezer that would go to minus 86 degrees Celsius. So by the time we finished everything, it was close to Christmas time. So we had to make all due diligence to work with different departments. At that time, we found out that the freezer would cost over $10,000. So that's when we really had to work with all the departments of procurement, legal, finance, the mayor's office, and other to be able to make sure that we could purchase this a freezer or an item over $10,000. So we did that, and it came on the it was scheduled to arrive to the city on the 20th of December, but it arrived on the 30th. So we did receive it. It's lodged at the Brockton High School in a room that is that has surveillance cameras in it. And also on Tuesday, which is January 5th, we also received the Moderna vaccines, because since both of them have been approved, in other words, the Pfizer as well as the Moderna, it seems that in Massachusetts, we have a larger quantity available in the Moderna vaccine. So at this time, we have 600 doses of vaccine in the freezer, which is locked at the Brockton High School. Now, a big difference between how to maintain or to store the Moderna versus the Pfizer. The Moderna is stored between minus 25 degrees Celsius to minus 15. So that's where it is right now. I mean, it's in the freezer over there at the high school. And we start, well, I'll stop here because I think I'm going to another point. So if I will answer any question that you have on that, and I'll keep anything else for later.
Okay, so that we have received the Moderna vaccine. You have the freezer. It is at temperature. The doses are available. Can I ask, and others can ask questions as well. We'll be notified. But you know, for the city, across the city for vaccinations, you know, what role in the vaccinations will the city be playing for the Board of Health? Be playing in doing this in comparison to the various health systems within. So you know, the healthcare providers at the local hospitals, with some information on whether they've been provided with vaccines and sort of an overall plan for how we're going to be participating in the vaccine of the citizens of the city.
Okay, good question. Actually, the phase that we will be doing on Monday covers the first responders. So the city has been authorized or given the go-ahead to vaccinate first responders. So that includes advanced EMT, EMS, the police, and the fire department, and any personnel working that is in direct contact with them and with public. So basically, the vaccines can be given to these individuals, also to any other group within that phase 1 priority population that hasn't received one yet. So basically, once we're done with these individuals, so any leftover we could make available for first phase priority population that did not receive one yet.
And how about are the hospitals within the city been supplied with their supply? I'm just trying to get a sense for,
Yes.
you know, how healthcare systems within the city. I know many of the systems are developing plans for how they're going to vaccinate their patients. I'm just wondering the coordination that's been taking place with the various health providers within the city.
Yes, actually, the hospitals, both Good Sam and the Signature Hospital, they started vaccinating already. The Brockton Neighborhood Health Center has received a smaller quantity, I think 300 to 400 doses. And last week they did their vaccination, and you may have heard that they had a little mishap because some people did not show up. So in the end, they end up throwing away one dose of vaccine, and the media took it and ran with it, as if they lost more than, they threw away more than one dose, but actually it was just one dose. So to conclude on your question, those hospitals, they have received their own dose, as well as the Brockton Neighborhood Community Health Center.
Right.
And
Go ahead, Dr. Andre.
I'm sorry, just to be clear, for everyone here, we're following the state's guidelines. Who's following the CDC guidelines? Is that correct?
Yes, but basically, well, the state guidelines, that's basically the one that we're using, because they're kind of in sync with CDC, but
right.
For any modification, they prefer that we go with them, and so that is why also we're not starting vaccinating the first responders until the 11th, January 11th. So tomorrow there will be a dress rehearsal at the high school to make sure that everything is in order, so that we can do the vaccination on Monday. Through the week, starting Monday at 8 a.m.
And the other question, just to be clear, so the distribution for the state, they're then, is it the Department of Public Health that's managing, or the governor's office that is allocating everything?
Oh, the Department of Public Health, sorry.
And allocating it to every city and town across the state?
Yes.
Yeah.
Yes, in fact, they delivered here this on Tuesday at about around 9 o'clock.
Thank you.
Thank you.
Okay. And so you'll be coordinating with the Department of Public Health then as our supplies come in, and then also opening clinics according to the guidelines to bring folks up, and the vaccinations will take place at the high school. Is that correct?
Yes, that is correct. And we also have Steve Hook, who is the director of emergency preparedness. So he will be joining us at the high school tomorrow. The mayor and Worcester Ambulance, just to give us extra help, because we're planning everything to make sure that everything goes smooth, because that will be our first trial and error. Hopefully it will not be error, but we want to make sure that at least this phase goes well, because that will be the scaffolding, to be able to build for the second phase and third phase later on in the year. Right.
Yeah, and I just a few questions, because this is much more complex than giving a giving the flu vaccine, because it requires, not just the handling, but also the availability of folks for if there's a response serious adverse event that occurs with it, that there's available the EpiPens and the emergency response team there. Most people are observed for 15 minutes post-vaccination is what the guidelines are saying. And so, that whole system. And on top of that, you have to follow up, sure that the appointments are made for follow-up for the second vaccine, which for Moderna, I believe, is 28 days with 1 day plus or minus, as the guidelines currently say. So, so this is not just the first vaccine. It's yes, we're starting with the EMS, but 28 days later, folks have to come back for their second vaccine. And then also, this is a fairly complex system, much more complex, as I said, much more complex than flu vaccines. And also storage, and, once you thaw and bring the vials to room temperature, you have to use them within a certain time frame. So really, having people, the last, few, and this is such precious right now, having available folks to be vaccinated, that, if there's one dose left, to be sure that, that you're aware of what's coming in. And if somebody misses an appointment, at the hospital, it's always been that, last minute, if there's someone that hasn't been vaccinated, to be sure that vaccine is used and not destroyed. Every vaccine should be given at this point. So it will be a learning event for you, but and starting with the police and EMS is will be good. But how you set this up is critical. Do you have the support systems around? This is a lot of logistical support to pull this off.
Yeah.
Will you give guidance from the state? Are you given the guidance that you need and have the support that you need as you practice this and do it with the EMS folks in place? And planning for bringing the public in is going to be even more difficult, I think, in how we do this. So it's important that lessons learned are and the ability to adapt to make this work is important. We've got to be able to. It's a difficult situation, so it's going to take a lot of logistical work to pull this off. It's been slow. I think everybody that has started, it's been a learning curve for everyone involved. And so, it's going to have to be, all hands on deck to get this right. So.
Yes, we had a Zoom meeting today. The mayor scheduled it. So we had the fire chief, the police chief. We had Dr. Cobbs at the high school because we're planning the site. Dr. Thomas, the superintendent, Ken Thomas. Thompson. And also there were Dr. Cahill, Linda Cahill. She's going to be involved in it as well. And we have a follow-up, a dress rehearsal tomorrow. And
Okay.
most of us will be there at the high school to make sure that everything is in sight to start on Monday.
Yeah, and did you get from the state any of the information that needs to be handed out to individuals about side effects, reporting of side effects, et cetera? Was that provided to you, or?
Yes, we received all that. We downloaded them.
Okay, great. And so the Be Safe stuff that's coming from the CDC and how to sign up for that and to monitor and who to call if side effects occur, et cetera, are all in place.
Yes, we're setting part of the one room at the high school where people will be observed for the time that they allotted by DPH or CDC, 15 minutes to up to maybe 30 minutes, depending on the situation.
Great, wonderful.
Dr. Monsoor, can I ask a follow-up question? And the questions that I hear Dr. Brophy give just raises a higher, more kind of communication channel concern, at least from my perspective. And Dr. Brophy, I welcome your feedback as to what is the usual practice around these kinds of things. I remember when we were in the swine flu, and that there was a whole different dynamic around here. And my understanding is that the boards of health were part of the planning of these kinds of considerations, and this it seems have been somewhat out of the loop and not even been invited to some of these Zoom calls and things like that. And so I'm wondering, one, what would be the normal protocol around this? Would the board be directly involved in these plannings and considerations, given some of the expertise that the board represents and responsibility we have? And then is there something that should happen differently moving forward from here?
So I would say, when the swine flu thing occurred, we were, it was a plan was put in place, never really executed because large vaccinations didn't take place at the time. The high school was the site of the event, and there were the emergency systems were involved. But again, that was for what was considered a routine sort of one-time flu type of vaccination.
Yeah.
As I'm saying, this is far more complex, and I think even systems that are used to doing high volume flu vaccinations, and the reason that the vaccinations have been so slow getting out the door is the logistics around this, and getting things set up around it. So, and that's why it's been slow in the go. We're hoping that as we learn, we'll get this better and move more quickly. But it's, even the storage, getting it out of the freezer, we're only defrosting a few at a time, and it's in the fridge. It's allowed in the fridge for a certain period of time.
No, I appreciate that. I guess my question is that should as a board of health be in partnership as we're doing these kinds of coordinations? And again, hearing your conversation, knowing my own background around this, and from being, not now, but understanding the workings of the board of health and having, uniquely for Brockton's sake, having a unique tie with the Board of Health in a way that could help serve this process in a good way. I just am surprised and wonder whether we should be somewhat more involved and in the communication loop.
No, I think it would. Certainly, our expertise is here, and we're going through it. And we do have, we are available, and certainly our expertise is available to the city at any time to be used in this and in the setup of the clinics as we move forward.
I'm just thinking more according to our charge. I mean, is this something that is part of our responsibility and therefore we should be involved, or is it really not our responsibility and we just stay to the side and be called on as needed? I'm just wondering what is the actual, we have a new mayor that may not, I'm just wanting to be sure that we're not being sidelined, or on the other side of the coin, that we're following our guidance and our responsibility as appropriate.
Right. Yeah, it had always been a guidance from the board. Again, never having gone through this before, we've never been involved in the execution, but that's because we never had to execute in the past. So it had always just been in a guidance position that we operated in preparing plans, making sure the vaccine's in place, making sure board is capable of producing doing the work. And I think that's where our responsibility is that the Board of Health is able to execute against the plans that are being given to us by the state.
You mean the health department?
The health department, exactly.
Yeah. So the mayor isn't obligated to kind of engage us in this process. I'm asking that question.
May I jump in? I mean, I don't know. Is that okay? Can I jump in now?
Please. Yeah. I mean, no, you're.
We're...
No, actually, I mean, personally, I think, I mean, I don't know if there is a chart that was provided for the board, but I feel that I need your help a little bit more. And in fact, as I was planning for the vaccination, I almost didn't send this to, but I said, wait a minute, this should not happen like this, because this is a little bit great initiative. So I took the liberty and just sent it. And so therefore, my willingness to work with you is there. It's just that probably we would need to set the parameters so that we know exactly how much you want to be involved, and how much you want me to work with you and give you heads up on things, so that we could be more involved. And I think it would be for the greater good of the health or for the department, as well as for the community, the health of the community.
Well, I think there's an ease of this. I mean, COVID, the silver lining is the ability to get on a call or on a Zoom call, even by phone, and just be there as a resource if needed, and be able to pitch in. I mean, I'm literally 3 minutes from the high school, and working from home in general. So, and I'm not trying to get in the way, Dr. Monsoor. I'm just really wanting to make sure that, one, that we're managing our own responsibility, and two, that we are making sure that the city has all the potential resources it could use. And I'm grateful for everything that you've done, and for our nurse friend at the high school pitching in, as she always has been. But I also want to be sure that we're holding to our own kind of fiduciary responsibility.
Mm-hmm. Oh no, I mean, that's I'm there with you, Dr. Andrade. I want you. I need your help. And so therefore,
if you relay that to the mayor and let them know that we're happy to help and happy to be a resource and welcome as available to be and part of these Zoom calls. Again, all of our schedules are challenging in all kinds of ways, and I don't want to overpromise and underdeliver, but at the same time, we're all in this together in a way that it seems to be at least making the invitation, and knowing that we will do our best to support.
Okay, I'll bring this up to the mayor also in the Zoom meeting. So as for tomorrow, we're supposed to be there at about 10:45, 10:30. Any of you would be interested on being there to see the dress rehearsal? Because I mean, as the board of the executive board, I mean the executive health officer, I don't see any problem of you being there, and so therefore, I mean, legitimately, you have a place there.
I appreciate that. I mean, I can only speak for myself, obviously. Given learning this now, I am literally booked from 8 o'clock till 5 o'clock.
Okay. So,
every single slot is filled with planning. Go ahead.
Situation, everything is full out. Trying to so I'm booked solid as well, and involved in a lot of the clinical care. So cannot alter my schedule very quickly to be able to be there. So sorry about that, but certainly, keeping us informed. We're all going through this together. I think we appreciate everything you've done. All the members of the Board of Health have done, all the help that everyone in the city, and all the work that the mayor and the various department heads have put forth in getting this together. And as I'm saying, this is going to be an iterative process where we're going to be learning as we go along, and finding the way to do this in the most effective way. I think keeping in touch with other members of boards of health, or any, it's lessons learned of how to get this to maneuver in a safe, fast, and effective way, and not have lines. And you want to be able to get the vaccine into arms, to get people there, to be sure that they're there, not to waste any vaccine. These are all the things that we have been the issues that have come up as people have been doing this. And it does, as I said, it is a very big logistical challenge, and and also knowing supplies that you're going to get, because we do have to give those second vaccinations. At least at this point, there's not been a change in the guidance yet. Though there's talk of changing it, but has not changed. that we have to be sure that we can follow up as well, et cetera, to make sure that we're following the guidelines appropriately. So and like I say, anything we learn, and keep in touch with us. Any problems you're having, to keep in touch with us. We will keep in touch with you as we're learning stuff through our own expertise and involvement in this at various levels, to provide you with any help that you and the board may need and the health office may need in executing appropriately.
Dr. Monsoor, I just put my assistant's email in the box. If you know meetings are coming up and can send me and her my email, you have my email address. I'll put it in there too. If I know ahead of time, I'm always more often than not able to readjust my schedule. I'm not seeing patients, so as need be, I can adjust. So if you put the ADP, Associate Dean of Practice, School of Public Health, SPH at bu.edu, and then my email, you'll get my assistant, and she'll make sure that I can move my schedule as needed for either in-person meetings or Zoom calls. And I'm happy to consult with you, knowing that I'm local, as you see fit, and even come down to your office.
Okay, thank you so much. I'm copying them as we speak.
Now, this meeting, can you hear me now?
Yes.
You can hear me?
Yes, Mr.
Yeah,
Yes, Mr.
at 10:30 tomorrow. Where is that? At the high school, is it?
At the high school, yes.
I might be available if I can help out in any way.
Oh, super. I would love that.
Okay.
Any other discussion on this? And as always, I'm always available to you, Dr. Monsoor, at any point. You know how to contact me and get in touch with me. So.
Yes, thank you, Dr. Brophy.
You know, I'm happy to. I'd be glad to see when the meetings are taking place, and if I'm available, I would, you know, try to attend any meeting that I'm free to and available to attend. So, happy to be involved. So.
Okay, I'll do that.
Right.
So, what also I'll brief the mayor on this, so that whether or not you're available, I'll make sure that you get the
Yeah.
Zoom links to the activities of the Board of Health.
Great. Wonderful. Thank you.
Thank you.
All right. I think with that, I think we've covered actually the next item on the agenda, which was the vaccination. I think we went from the freezer and getting the vaccine into covering that. So thank you on that. So the next item on the agenda is the dashboard on the COVID-19, the current statistics for the city. I took a look at it today. Very high positivity rate in the city. Any further information, Dr. Monsoor, that you'd like to inform the board about?
Yeah, well, they're very startling. For the current active cases, we have 2,173 as of today. Cumulative cases from the onset of the pandemic to date, that's 9,145 cases, and total deaths, 348. So quite startling.
Yeah.
Is that since Christmas or?
Well, no, the current cases are people who are still active with COVID, which is the 2,173, because we have quite an upsurge in cases. And I think the two hospitals, the two area hospitals, they're also kind of over capacity right now. And then the 9,145, that's going all the way back from the first recorded cases for the city. And the total deaths is total cases of, total number of people died, but we were supposed to have a cleanup in the death cases, because we have discovered that the definition for people dying of AIDS, or the pathological definition, anyone who dies 90 days after they contracted COVID should not be included in the mortality, but we have a few cases that DPH has not removed yet.
Okay.
Rick?
Thank you. Well, this is actually you said the hospitals, are the hospitals currently in the city diverting, or are they just at the approaching capacity? Are they in diversion?
Yeah, from what I understand is that they're going, they passed, they supposed to be at 50%, but when they pass that, 50% of
COVID capacity.
yes. So
Yeah.
it's really, they're reaching a critical point. So they reaching that critical point.
Okay. But not at the point of diversion yet, so there's still
No.
availability, right? Okay, so they're getting to a critical level, and hopefully staff issues. It's not just issues with beds now; it's getting to be issues with staffing as well. So, the ability to expand beyond your COVID capacity is becoming difficult. So, yeah, it is. Right now, we're sort of in I think the next few weeks. I think most people are expecting the numbers actually. To be rising, so it is concerning, and as much as we can keep the information out there as much as possible about the, social distancing, staying in your local pod or family unit, and not wearing your mask, etc. All of the guidance that goes with it. I mean, it's disheartening that the pandemic is occurring right now as the vaccine is out there, because there's light at the end of the tunnel. But really, right now is the time that folks really need to stay as much as possible, isolate as much as possible in their local areas of folks that they're in close contact with in their normal family or living situation at the moment. So, as much as you can keep that, stress that, and keep that going in the city, it's important. So.
Thank you.
Contact tracing?
Yes. As it relates to contact tracing, we do have active board members, the 3 nurses. They are working. One still is not qualified yet on Maven, the system that DPH develops to help keep contact with, identify cases and try to mitigate cases. So we are still receiving help from CDC, the collaborative consortium, but because the cases have gone up quite drastically in the last several weeks, so we still haven't caught up yet with the with all the cases. So there is a delay. We still experience a delay in contact with the people.
This has been a problem. This has been the problem because there are so many cases right now in contact tracing, and some delays even in testing. That is, it's a little bit like the cat's out of the bag here of trying to get be effective with the contact tracing. So understand completely. It is a lot of work to do that, and unfortunately, you have to contact the contact tracing is important. Finding people early and stopping the spread, which is difficult to do when there's so many cases, and testing that may be delayed. So understand. So it's good to have the 3 nurses on board to be able to help as much as possible. So, how about the next item is the hiring of the ambassadors and interns, which apparently has been continues to be an issue.
Yeah, that continues to be an issue because we don't have that many applicants, but I have had a discussion with HR and finance department. So therefore, we're going to, we reopen the job application process, and then we increase the compensation from $15 to $20, and then we will look to bring in also a coordinator / supervisor that would work to coordinate that, and that the coordinator would be at $25 per hour. That no benefits. beyond that.
Okay, all right. Any questions from anyone on that? So,
Nope.
okay. The health promotion and public health education?
Yes, this is the part that we continue to work with some of the stakeholders. There are two particular group of clergies that work with the mayor or that meet with the mayor weekly. So they're part of the group, and there is another group that worked with the mayor's director of constituent at the mayor's office, John Messia. So those groups work together to see how we can address many different issues and help get feedback from them how to best address issues relevant to COVID or other issues, how to work together with the community. So it's an ongoing process, and so far I would say it pays some dividend.
You know, I think important now moving forward in this, and these community partnerships are important, is the information about the vaccines. I mean, encouraging people to get the vaccine and providing with the information that they need to know that, you know, because there are still, even in folks, in a number of situations where many people are worried about taking the vaccine. So as much as we can provide the information, the more that we're giving the vaccine and getting more safety data, you know, it's becoming clear that, you know, these serious reactions are not at a level that's sort of unexpected for the usual vaccination type of situations that we've had in the past. It's really important that information get out there because it really depends on, you know, we have to get the population vaccinated high enough that we get the protection that's needed. And I think there's still skepticism about vaccinations, and particularly about these vaccinations, because it's a new type of vaccination that's being given. So I think it's, you know, use these channels appropriately and get out as much information about the vaccine as possible. Also, the information, I think they're going to be very important in getting out the information about what the city will be doing as far as vaccinating. And using these programs and the partnerships that you have in place to make sure that information is provided to the citizens of the city as we move forward with getting people vaccinated. So I'm glad that this exists and use it very hopefully. We've created effective communication systems that are going to allow citizens to know where to ask questions and get information from multiple sources that is consistent across the city. So, any questions from other board members or any comments?
Dr. Montessori, last time we met, I believe you were planning some radio engagements. How did they go?
Actually, thank you for bringing that up. We did have a few interventions. The mayor had one with, well, he had several with some stations throughout the city. One of them he attended, I think probably maybe two of them. I'm not too sure on two, but I know he attended one of them with Dr. Herman, his medical consultant. And I also attended two. One is stationed in Brockton here, they call it TheBrockton. It targets the Haitian community predominantly. And then there is another one they call Télé Planète Compa. That one is stationed in Randolph, but it broadcasts throughout many communities. So I also had one there on remote. They went very well, and we had many questions, and some of the interventions that we had, we packaged the message toward how to remain safe during the holiday. So that was a major message during the holiday season. Thank you for asking. I always forget that.
It seems like when you use the radio stations, that's more of what more people look at and listen to nowadays compared to the paper. I know there was a small article saying that we did receive the vaccine, but you know, the paper is like a thing of the past almost. So it seems like more people, you know, between Facebook and and Google and some of these things, that's where we should be putting the emphasis on getting this information to the radio station, to other sources than the newspaper now.
Agreed. I think, yeah, when it starts to move towards the general population vaccination, I would encourage you to try to look ahead and see if you could book yourself on some of the local radio stations so that we could reach particularly Haitian populations from your language capacity. And if there's other ways to do it with other non-English speakers, and then with the general public through English radio, would be a great way to reach a whole bunch of people to help address their concerns and encourage them to engage.
Thank you. Thank you. Yes,
I'd also be very transparent in how the vaccination stuff is going. So, you have a nice dashboard about the COVID infectivity within the city, but also, what we're doing. I think that on the dashboard now should be information about the Department of Public Health about the vaccinations, about what's been done, the tiers, and as our plan becomes available, what that plan will be for vaccinating and how many keeping track of how many vaccinations we've given in various areas. Transparency is important, and as we move forward in getting these vaccinations out, and that we are being strict in following to the guidelines of how the vaccinations are being used within the city. So.
Okay, thank you.
Okay. All right. Any other issues on that? Okay. The nursing positions, I think, are in place. We have our 3 nurses. Can I ask, with the vaccinations going on, will the nurses be involved in the vaccination, or is this where the school nurses are going to be assisting us? Can you fill me in on?
The school nurses, some of the school nurses will be assisting us, but the 3 nurses will be involved as well.
Okay. All right. Great. Any questions from anyone?
No.
Okay. And then the last item on the agenda is December 16th that the mayor passed an executive order for a 2-week rollback. Can you provide an update to the board?
Yes, as of yesterday, the mayor has rescinded the order for 3 weeks. So I think that will provide an observation as to whether or not we should go back to, to enforcing, to put in place another executive order. So as of yesterday, the December 16 order has been revoked or rescinded.
Any questions from anyone?
No.
Okay. All right.
If I may,
Nope.
There may be something coming up our way for next month. So maybe you can tell me, I'll provide you with more information, and you can also tell me how you want that. There is a store called Shivam Variety. They have lost their tobacco license, and some issues happened before I arrived. And so it seemed that they were told that if they go more than 30 days without reopening, that they would lose the license and they would have to reapply, and the reapplication would have to come to you as a board. And so they were looking to find some other means to try to reopen, but the protocol is that once it's closed, and based on everything that I've been briefed on, in order for them to reopen, to have a license again, if it can be done, they would have to come to you. So this, I would try to see if I can get everything from them, and depending whether or not you want to give them an audience. So we would have that on the agenda for next meeting.
Why did they lose it?
There was some issue, I think, that did not match the protocol, and also they were, because of COVID, they have to close also. But it seemed that beyond that, they went far longer than they told us, or they anticipated, but it seemed that somehow there was a change. We're not too sure, but I'll do some investigation on that. It seemed that they have planned to sell the business, so I don't know that for sure. But it seemed that in between they just wanted to reopen, but they were told that they could not just open like that because they went more than 30 days closing. So
they didn't lose the tobacco they didn't lose the tobacco license because of something that they did.
no, it's well, I mean,
So-
there is some issue. I understand that it seemed that they did sell. Now I don't have the documentation on this, so I will.
So I would suggest, this is Dr. I would suggest that we gather the data so that we have accurate data around and what their request is. So, get the information on what led to the license, the no longer having the license, the information around that, and then the circumstances as to why. So that and usually the appeal comes from the group that comes before the board with an appeal. But at the time, whoever in the Department of Health has been involved with this would do a review, gather the data, and bring it to us to review. It's usually sent out ahead of time for us to review in the packet that comes to us, and then we will we will meet with them at their request at the meeting. So and I would recommend that we hold off on this until we have all of the data in hand to make any discussion around it, so that we have accurate data in front of us. So.
Yeah, thank you.
I agree.
So next item is just miscellaneous. If there's any other items for discussion or any other information that folks would like to
Just
bring.
briefly to return to were you going to say something, George?
No, go ahead, Craig. Go ahead.
Excuse me, I'm sorry. The 2-week rollback of, I think it was some church activity, gyms and things like that.
Yes, it covered predominantly gyms and sport complex, some restaurants also, and place where they serve alcohol, because of the increase in the numbers of COVID. So the mayor rolled back because the numbers were increasing so much that he took that also in concert with some other municipalities. But so far, some of the other municipalities have changed a little bit, but some of them still keep it in place. But you may know also that I think just this morning, I noticed that there is a new order that the governor passed also. I don't have the detail on it yet because it just arrived. I just noticed it today. So all of that plays a role in how we move, because the mayor said that when he put it in place, there were two things that he made as observation. One, there were many people who were very unhappy with him, thinking that that wasn't going to do any good to roll back the numbers. And so people were very vocal with him on that. Yeah. And so therefore he looked at it and then said, well, he will take the heat, but he will rescind it and then observe for the next 3 weeks.
The reason that I ask, and there's where it may have been helpful to have somewhat of a conversation with the board members here. Those kinds of things generally are challenging. In particular, one, the data about gyms and other facilities and as hotspots for COVID are not consistent or clear. Two, in a region like southeastern Massachusetts, if a city like Brockton does one thing and Randolph, Easton, and Avon do something different, it undermines the process. For a concrete example, my gym was closed in Brockton. I just went to Diversion in Randolph because they didn't do it there, and I just kept on going to the gym and coming back to my home in Brockton. And I'm not being malicious about that. I obviously kept with my mask and social distancing and all those kinds of things. But the point is that if I, as a health professional, understand that the data doesn't show this as to be effective, and I have an opportunity to go to the same chain of the gym at literally 15 minutes away, it really doesn't serve the purpose that the mayor is doing. And so finding ways for a collaboration across neighboring cities is the way. If you believe that's a concern and you want to make an impact, that's the only way you're really going to be able to do that. And so again, I appreciate the sentiment and the attempt, but it gets undermined in all kinds of ways unless you really have a more coordinated plan. Does that make sense?
Oh yeah, this is a point where I think more heads can make a better, more effective decision, and so listening to many voices, different sectors of the population, I think that gives a better understanding of how to move. Yes,
largely it's a microcosm of what's happening in the nation. Every state is doing something different. Some are doing masks, some aren't. And if we do that within our state, every city is doing something different. We really are undermining any success at all. And so it's that challenge where you can make some stands to make a statement, but it really is just making a statement, isn't it necessarily adding to the safety value in a way that we would like. And I'm not trying to undercut the mayor by any means. I'm just saying that when people can just go across city lines to the next place, then you really aren't getting the bang that you're looking for. And I welcome your input, Dr. Brophy, if you have any thoughts about that.
No, I agree. It's been very hard to know the data and the impact because there are so many changing pieces of the puzzle. Even now, the mayor watches over the next 3 weeks. The impact of his rescinding the order is really not going. The rates are going to go up. What's happening 2 weeks from now is what's happening because of New Year's Eve and the holidays. And so the rates will, we're expecting, as they have been doing, the rates are going up. We're waiting for it to plateau, but we're still getting through the holiday events. So it's going to be very hard to judge what impact of any of these things, these types of things like stopping gyms is having on it, because it's going to be overwhelmed by the fact that so many people traveled, and we expect the rates to go up at this time point. So it's very hard, as Craig is pointing out, without collaborative efforts, without a consistent message and a consistent plan being followed, to really know the impact of any of these restrictions that we put in place. And that's been the challenge from the beginning of this, is that there is no consistency across communities, across states, etc. To really help. The one thing that we do know is that wearing masks, washing your hands, keeping social distancing, and not gathering in groups is the way is effective in stopping the spread, and as much as possible, that has to be stressed in every way. So
I agree.
all right. Any other issues?
I get one issue that by riding around the city, I've noticed lately, of course, you see the people, under the bridges, which doesn't seem as many people as it used to, but I've seen a lot of tents on Pleasant Street in the woods, and then behind, the Outlaw Clubhouse and stuff. There's a lot of people that are living out in the cold, and I'm really worried about them. And I didn't know if there's anything that we can do, the Board of Health of the city, to help out some of these people. I mean, a society is based on how they treat, their people, and these poor people, it's cold, and they're living in tents. I remember when they had the tent city, but it's still here, and you can see this through the woods. Is there anything we can do as the Board of Health or to get these people some bedding, or get some heat, get them in some type of facility?
Yeah, that's a good question, Mr. Fisk. And on Thursday at from 9 to 9:30, there is a group among health, different departments that meet to discuss these issues and some of the sanitation problems also, and various issues, and that also affects homelessness, people living in those areas as well. The group is called Quality of Life. So basically, it's a group of, it's made up of the police department, the fire department, building, Board of Health. So they address it, and I think one of the handicaps is resources in terms of finding place for them. It seems that the city seems to have a problem with housing. And Father Bill, for instance, who is one of the people who have shelter in the city, I think many times they run into overcapacity and they try to stretch out and find place to put them. So I welcome this, and I don't know I don't know what to say, how to address it, but we certainly can use your expertise or suggestions on that to see how to best assist them.
Early in the COVID crisis, the state was trying to coordinate some efforts around there, partly because of the homeless crisis and the food insecurity that is part of a connected crisis that is expanding not just across our state, but across the country. And the same is true for people who are homeless. So they have been working with, the hotel industry has been down. Not a lot of people are using them. And so there's been some kind of synergies that have been tried to create in terms of homeless hotels that have been vacant, and filling those spaces with some backing from state funds to help people have a place, especially in the winter, not only for homelessness, but to reduce the chance of COVID being spread to homeless people or from homeless people. So it's all those things. If they don't have shelter, they also don't have protection against COVID. And so there's all those reasons to lean into this. If you have a contact at the department and can ask about the status to that, I'd encourage you to do that. And if you don't, then let me know, and I can see if I can connect you with somebody. And I'm not giving a solution. I don't know if that program is still going. I'm just saying that there are other cities and towns that are dealing with the same thing in Massachusetts, and the state has been trying to coordinate that.
Okay.
Good.
Craig, I'm not sure if you know, but the support that's coming from the federal government, was there money in place? Do you know if there was money in place for this? I would hope for food insecurity and for homelessness, that similar sort of support that was in the first bill may be coming to the state as well.
I don't know how the second round of it, what it included and what it didn't. There was all kinds of wrestling with that. So I don't know the details of the second round.
Yeah, so it is important, I think, Dr. Monsoor, to be in touch with the Department of Public Health, and since the city does have issues with this, to be aware, because there may be, as this money is coming to the state now, and if there is some money for this, that the need within the city is important, and making sure that the state is aware, the Department of Public Health, I'm sure, is aware of it, but be the squeaky wheel, and as much as possible to get as much support as we can in this situation. So.
Yes, I make some notes. I take some notes, and I will do the research.
Great. Thank you. Okay. Any other issues?
No,
Thank you.
Okay. So the next Board of Health meeting, sorry, Craig, did you have something else to say?
no, I didn't say anything.
Okay, great. So the next Board of Health meeting is scheduled for February 4th at the same time, 4:30 on Thursday afternoon. If there's no other items, a motion to adjourn from the committee, the board?
So moved.
Motion to adjourn.
All right, all in favor?
Aye.
Aye.
Aye. Okay, so the Board of Health meeting for the city is over. Thanks, everyone. Do stay safe, and Dr. Monsoor, do keep in touch with us about what's going on in the city, and feel free to contact us at any time point for assistance.
Yes,
And
thank you.
Eno, keep up the good work. You stepped into this role in a unique time.
Thank you so much. Dr. Brophy, I'm also dropping that file for you.
Okay, thank you. And also give our best and thanks to the members of the Board of Health and those that have been helping you, because I know they've been stretched immensely, and you've been understaffed for a long period of time, and they're I know, like everyone in this field, everyone's working 150% to make things happen. So a thank you to your staff as well for all the hard work that they've done. So.
Give
Thank
Linda
you.
our thanks too.
And Linda.
Yes, I will communicate that to them.
Okay, thank you.
Thank you.
All right.
Hopefully one day they'll meet you also. They meet you.
Yes.